things today, we're going to start with a COVID update. It's going to be a WebEx presentation by Annette Rodriguez, our Public Health Director. And as you may be aware, she is home quarantined due to exposure to a family member who tested positive for COVID. But I think our staff's queuing up her video she was working on, or presentation, just to give the council a quick snapshot of where we're at today.
Quite different. I think everybody knows the numbers were on Monday the 15th, we had 24, on the 16th, 31, on the 17th, 29, on the 18th, 65, on the 19th, 63, on the 20th, 49, on the 21st, 36. So those numbers tripled compared to what we were having the week before. And so we knew, you know, everybody knows there's something that's going on. The community spread is just spreading exponentially at this point. Our highest number of cases was the week of June 19th, last week at 212 cases. We know that we're going to surpass that number because yesterday we had 109 cases just in one day alone. So we're going to surpass that. The other thing is that their family members need to be quarantined. I've heard individuals saying yesterday, well, they're quarantined, but I'm fine. I'm still going to work. I'm not sick. That's not the case. Like I said, I'm staying home because I'm in that incubation period. The incubation period is the time period that when you actually got exposed to an individual that was sick, now within this period, and it's 2 to 14 days, you can actually pick up that virus at any time during that incubation period. And they have to understand that. And so they need to make sure that they also stay in quarantine for the 2 to 14 days so that they don't expose other people. Because it's not that I don't have symptoms today, it's that I didn't know that I actually was going to be sick tomorrow and I could be spreading the virus today. That's the real issue. In your house as much as possible. There are some individuals that struggle, that need to get some groceries, and so we tell them, let us know, we'll try to help you with those resources. But that's the time to reach out to family members to ask them to come and drop off groceries for you, drop off food, you know, make sure that you have your needs met. But quarantine for 14 days is essential that you do that. You are positive. You cannot spread this to the rest of the community. Now they have an altered sense of taste. So they say, I've always eaten pizza all my life and I love pizza, but now it tastes really salty, which is really strange. And we don't hear it from one person. We hear it from many people saying the same thing. And our soup is very bland. That's more like a loss of taste. But to say that the pizza is very salty is a very interesting change in what we've seen before. So today, if we did the 800 today, you may only see, from the report today, you may only see from the first 300 or 400 those results. But from the other 300 or 400 from the rest of the day, you will see them in tomorrow's numbers.
The delay is from other persons that are doing it, like the National Guard, when they tested the seniors. They were sending the samples all across the state of Texas, and their agents that were the locations that were doing the analysis were taking a long time. But Annette's group is working hard, and they get results out the same day pretty much. Unless it's a big
the majorities were community spread, is what I understand. Is that correct?
That is correct.
Okay. Did we ask, or do you know if any of these individuals were part of the protests that were a couple of weeks ago?
I haven't heard that they are, but you know.
Are we asking a question?
They may not have asked the question. You know, there's so many questions that you can ask.
Or more protests down the road, and if this is a problem, we should ask that question. Can you ask that in going forward?
Yes, we can add it to special event, you know, events, large events, or venues like, you know, a protest. So we can add that in.
Okay. Second question here in terms of discussions with these individuals, are we asking them what precautions they've been taking For example, had they been maintaining social distancing, had they been wearing masks, or had they been doing anything specific and along those lines?
Yes, absolutely. And many of them have because they're actually sick. And so they'll tell you right away, they'll say, I haven't gone anywhere. I've been sick. And so they'll tell you they're nauseated, they had diarrhea, so they'll tell you all of those things. And so, but we are asking to see, because that's how they do the contact tracing. We have to know, not only what behavior they've been practicing, but where have they been the last few days and who have they been in contact with.
Asking those questions specifically, and in this case, since we're talking about doing an order to require people to wear masks, are you following up with that?
So many of our staff do ask those questions because we have a script, and so we go through the whole script. But we are streamlining some of those questions just to be able to go a little faster. Our main goal is to actually make sure that anybody that they've come in contact with is contacted, and that they know that they have to be isolated. Otherwise, they could be out there spreading. And then all of those other things, those questions, we're putting them down for statistical purpose. That's really what we need to know.
That's what I'm trying to get at. I'm trying to determine what the effectiveness is of the things that we're promoting.